Well, good morning and welcome to our Friday career chat. My name is Holly O'Brien and I'm a career coach on the North End. And I am pleased to welcome Matt, the Director of Health Services at Stonehill's Community. Matt, if you'd like to introduce more about yourself, that would be fabulous.
All right. Good morning, everyone. Thanks for spending the time with me this morning. As Holly mentioned, my name is Matt Jahn, and I'm the Director of Health Services at Stonehill Communities. And I'll give you a little background about myself. Uh, Next slide. Um, I started working at Stonehill Communities as a certified nursing assistant in 2008, and I attended the University of Dubuque here in Dubuque, Iowa, and graduated with my bachelor's degree in 2011. I became the assistant director of nursing at Stonehill in 2012, and I eventually became the director of health services, which is my current position, in 2015. Um, I actually attended Jefferson Middle School in seventh and eighth grade. That was before they started having students in sixth grade there. And then I attended Hempstead High School for high school, and then I went to NICC, Northeast Iowa Community College, for 1 year. Started there, and then transferred to the University of Dubuque my sophomore year, and then graduated from there. Um, I am actually currently in school to become a licensed nursing home administrator, and I'm hoping that I can continue my career at Stonehill in that capacity if that position becomes available at some point. Um, and as I mentioned, I grew up in Dubuque, attended all of my schooling in Dubuque, and currently live in Piasta with my wife, Hannah, who's a fourth grade teacher at Macokota Valley out in Delhi, and then we have 2 kids.
Awesome. Matt, so as you know, there will be a sheet that students are working on. And so as we go through this PowerPoint, we will reference to some of the questions. Students, make sure that you are paying close attention because the questions may not go in the order that it is on the sheet as well.
Sounds good. So a little bit about my nursing background. As I mentioned, I attended the University of Dubuque and graduated from there with my bachelor's degree in nursing. We'll talk a little bit more about the different levels of nursing, and we'll actually talk a little bit more about careers in healthcare in general, because healthcare is a very broad area to get into, and there's a lot of opportunity and a lot of different career pathways that someone can kind of start out here and end up there. So it's really an exciting time to be in healthcare, and we're always looking for great people that love caring for people and love to work with people. So if that's kind of your nature, and you enjoy working with other people and helping other people, that could be a career path for you to check into in the future.
Fabulous. So I see on the bottom of your slide here, it kind of answers our question number 7. What courses do you recommend students to take in middle school all the way up to high school to kind of prepare them for a career in the healthcare field?
Yep. So getting into the science and math courses are really important. If you're planning to attend college and graduate with a degree in healthcare, whatever that may be, nursing or physician or something else, there all of those career paths are going to look to someone having a lot of experience and a lot of education with the science and math courses. The high schools in Dubuque, Hempstead and Senior, both offer the CNA course, the Certified Nursing Assistant course. And I would strongly recommend that for anyone, regardless if they're thinking that they want to become a nurse, or if they're thinking that they might want to be a physical therapist or a doctor. Becoming a CNA is really a great segue into getting into healthcare and working with patients, getting to know what areas you might want to get into. And of course, we need people that choose to continue working as a certified nursing assistant as a career. So taking that course and completing that course and then working as a CNA would be a great way to get into healthcare and get some experience.
Fabulous.
So the healthcare system is very complex, and a lot of you probably already know some of the different settings that healthcare is offered to patients. But we'll kind of go over just a high level overview of the different areas, just to kind of know where healthcare is being delivered. So that we have the hospital system, which is where a lot of the care happens for someone who has an emergent need. If I get into a car accident or if I need some kind of a surgical procedure, I'm probably going to receive that care at a hospital. And then we have clinics, urgent cares, outpatient care settings. So this would be, if I'm maybe not feeling well, but I'm not emergently ill. Maybe I have some kind of a cold or upper respiratory infection happening. I might go in and see my primary care physician and see if they have a treatment plan that can help me feel a little bit better. This is where you go for sports physicals or just wellness checks. You get vaccinations and things like that from there, annual physicals, that sort of thing. And then there's life plan communities. So this would be caring for seniors or older adults. And this is the area of healthcare that I work in. At Stonehill, we serve residents in independent living, assisted living, long-term care, and short-term rehab. So we kind of have a broad spectrum of patients or residents that we care for in our community. And then there's home health care, which is where care is being delivered in the home. So a healthcare professional would come and see a patient in their actual home and make sure that they're transitioning well back from maybe the hospital or from a nursing facility like where I'm working. Um, then there's care management. So this would be individuals who are looking at the quality pieces of healthcare. So they might be working with insurance. They might be auditing things in healthcare. Um, and then there's education and research. So we obviously, when we're educating and training the next level professionals that are coming into the workforce, we need educators to be able to teach students how to become a nurse or how to become a doctor. Um, and so they're generally working in educational institutions. And then there's research. So thinking back to when COVID began and we had professionals that were developing vaccinations and things like that. That's the area of medicine where that sort of thing happens, research and development. And so all of these different areas of the healthcare system intertwine with each other, and they work together to really make sure that at the end of the day, the patient is receiving the best care and the care that they need at the appropriate level that they need care.
Fabulous. Yeah, you did a great job kind of touching on the different work environment. And even with all of these different kind of hubs that you have everything, do you guys collaborate amongst each other and have some kind of communication or interaction?
Absolutely. So on the next slide, we kind of show it's a little bit more of a visual of how these different systems work together. So at the very top, you can see the hospital system. The next level to the right would be the post-acute care setting, which would be like a skilled nursing or rehab facility. At the very bottom of the screen is the home, so that's where the home health would be delivered. And then to the left is the ambulatory care setting. So this would be maybe an outpatient surgical procedure, therapy office, that sort of thing. Each level, like Holly mentioned, we have to make sure that we're working together and that we're communicating with each other to make sure that we have a good transition of care when people are moving to a different level of care. So a good example might be if I have a grandparent who is maybe not doing well, that they had a fall at home, they had an accident where they fractured their hip. I might take my grandparent to the hospital, to the emergency department. They may have a surgical procedure, stay in the hospital for a couple days. After they're feeling a little bit better and they're stabilized, then they might transition to a place like Stonehill, where we would rehab them and work with therapy and try to get them back on their feet. And then we would work with transitioning my grandparent back to their home, essentially, if that's where their goal is. And so then we would collaborate and communicate with the home health agency that would be coming into their home and making sure that they're receiving their medications and that they're adjusting well.
Awesome. Yeah, that paints a very clear picture of all of the different opportunities and environments for students to be able to explore if they want to get into the health career field, because it is not just a traditional hospital. So thank you for painting that picture.
Absolutely. So Looking at nursing specifically, obviously nursing is my area of expertise and kind of where I've worked most of my career in healthcare. And so we'll kind of talk about kind of the career pathways that someone who's interested in being a nurse could potentially take. And I will touch on other areas of healthcare as well, because as I mentioned, working in healthcare is really about teamwork and collaboration, getting to understand what other positions and roles in healthcare do, to really make sure that we're providing the best care at the end of the day. So kind of how I got into nursing, I actually, when I was in high school, I took the CNA course, and I was in a lot of anatomy and physiology classes, and I thought that I wanted to be a physician. So I actually started at NICC, and I continued taking a lot of the microbiology and anatomy and physiology classes. Um, a lot of the students that were in those classes with me were nursing students who were planning to attend the program at Northeast Iowa Community College. And they were, asking me like, why haven't you ever thought about nursing? And, what's making you, what's your drive to become a physician if that's where you end up going? And I never really thought about nursing before. I didn't have a lot of nurses in my family, and I didn't really know exactly what that all entailed. But after I had more conversations and kind of explored it a little bit more, I found that nursing is really a unique profession where you can start and stop wherever your comfort level is, or wherever you find yourself fitting best. But nurses have a lot of options and a lot of flexibility to get into a lot of different areas. Kind of going back to the healthcare system in general, we need nurses in the hospital, we need nurses in the nursing facilities, we need nurses in the home setting. So when you're thinking about careers and maybe if you're wanting to make changes with your career, even within the nursing profession itself, there's a lot of different areas that you can continue to explore and work in, without actually changing a lot of your education or your background. Um, so kind of getting into the different levels, there's the certified nursing assistant, LPN, which is the licensed practical nurse, RN, which is the registered nurse.
Hey, Matt, when you talk about those, could you tell kind of what the length of that like career pathway, how long it would take to get that certification?
Yep, yep. So kind of getting into my next slides, I do kind of,
Sorry.
no, you're good. You're good. I do dive into how much education it takes, and kind of the experience and settings that we can work in. Um, we can kind of keep moving through to the next slide, and you'll see where they kind of overlap and intersect. So the certified nursing assistant is the first line of nursing. So these individuals are working on the team with the professional licensed nurses, to make sure that the daily activities and the daily needs of the patients are being met. So they're assisting patients with activities of daily living. So they might help someone with a bath, or they might help someone with eating a meal. They're making sure that all of the basic needs that someone has are being met. They might check vital signs like a blood pressure, a pulse, and then they're reporting that back to the nurse. And so they're assisting the nurse with responsibilities that they can assist with, but they do not need to be licensed for. CNA students take a 75-hour certification program. There is a state test at the end of that, so there would be a written examination and then a skills teach back scenario that they would need to pass. Um, and typically, kind of going back to the high school courses are taught over the course of a semester. So they're a little bit more than the 75-hour class, but if you were to take it at a community college like NICC, the class is 75 hours. CNA salaries, so typically they may start somewhere around $13 an hour, and they may earn up to $25 an hour or more. I know at Stonehill specifically, we start our CNAs at $18 an hour currently, and we pay more based on experience. So CNAs are working in multiple areas of healthcare, so they might be working in a life plan community like where I'm at Stonehill. They might be working in a hospital. They might be working in a clinic. They might be working in home care. So really, CNAs are needed in almost every area of healthcare, and they're an essential part of the team to really make sure that the patients are receiving the care that they need. Um, we do hire CNAs starting at 16 years old. And so, it can be an area that someone can start in before they take college courses. Um, and then the next level would be the licensed practical nurse. So the LPN is someone on the team who might assist patients with medication administration. They're assessing patients for their condition. They're reporting those findings from their assessments back to the providers. So the doctors or the nurse practitioners that they're working with. Um, Typically, an LPN is someone who has completed 1 year of prerequisite courses in college, and then they do 1 year of nursing school and clinical rotation. So it takes 2 years after high school to become an LPN if you're on track with courses. Um, After completing courses at a technical or community college, um, someone would need to take a board examination. Those are at a national level, um, and LPNs earn anywhere from $15 an hour up to $40 an hour. I know at Stonehill specifically, we start our LPNs at $24 an hour. LPNs can work really in any sector of the healthcare system, just like CNAs. So they can work in a nursing facility, they could work in a hospital, a clinic, home care, um, and there's a large demand for licensed practical nurses.
Fabulous.
And then the next level would be the registered nurse or the Bachelor's of Science degree in nursing, the BSN. Really, between these two nurses, there is no difference in their scope of practice or their ability to practice. The biggest difference between the titles are the level of education. So, a registered nurse or a BSN, um, these nurses are working in with patients, looking at the full comprehensive assessment. So, they're someone who has more of an independent scope of practice when you're comparing them to a CNA or an LPN. Um, they're helping pass medications, they're communicating findings and assessments back to the provider. Um, they have the ability to draw labs, they have the ability to insert and start IVs and administer IV medications, which are intravenous into the bloodstream. So they have a little bit more ability to practice independently. Um, and so the level of education for an RN would be 1 year of nursing coursework or pre-nursing coursework after high school. So they would take 1 year of college courses and then 2 years of nursing school and clinical rotation. So an RN would require 3 years of education after high school. A BSN is 2 years of prerequisite courses and then 2 to 3 years of nursing school and clinical rotation for a total of about 4 years. Typically, a BSN would attend a university or a liberal arts college um, where the RN would typically be educated in a community college setting. Um, but as I mentioned, they have the same scope of practice. So the biggest difference between the two is just the number of years that they're in school. Um, you may see some Bachelor's of Science prepared nurses in more supervisory positions when compared to an RN. But if someone completes the RN program, they always have the ability to continue on to obtain their bachelor's degree through various programs. So kind of looking at nursing at a high level, you can see that someone may start as a CNA, but depending on where they want to go and how much education they want to pursue, they could continue.
Yeah,
And then
thank you for painting that picture because it is nice to know that, You can literally go from in high school and get right into the healthcare, or you can continue on to get your bachelor's degree and do the full 4 years of it and everything in between that. So thank you.
Yep, yep. And then I don't have a slide for this, but the next level above a BSN would be a nurse practitioner or a doctorate of nursing practice. Someone could achieve their master's degree in nursing and teach. So they're again, nursing just is very broad and there's a lot of opportunity to pursue a lot of different areas. Kind of looking at healthcare in general, that non-nursing. Um, as I mentioned, we all work together. We all rely on each other as a team to really make sure that we're providing the best care. But we need people in healthcare that choose to be medical providers. So these would be physicians, physician assistants, nurse practitioners, chiropractors, podiatrists. And then we have people that work in dental, so working with teeth and oral care. So these would be dentists and dental assistants, dental hygienists. We need people that like making sure our patients are strong and they're in the therapy department. So these would be people that are providing physical, occupational, speech therapy. We need people that help our organizations hire people. So human resources is an area that people can work in healthcare. Maybe not providing patient care, but working in the healthcare industry. We need people in finance, so we need people that help us manage our costs and our reimbursement and payment. This could be like an accountant or a CPA. We need people that like working with technology and computers, so we need people in information technology. Um, Most healthcare organizations operate with electronic medical records, so we need people that are very tech savvy to help us be successful. We need people that work with medicine and pharmacy, so we need pharmacists, pharmacy techs, people that like working with drawing blood and working in the lab, to help us identify if our patients have a change of condition. People working in customer care support. So this would be people working with insurance and helping patients navigate and understand where they should go for their healthcare needs. People working in social services or activities to really make sure that we're looking at the whole person when we're caring for them and that we're helping them through whatever situation they may be in. We need people in X-ray, to look at helping us see underneath the skin what's happening with a patient. So X-ray tech and radiologists, people working with insurance and people working with nutrition and as a dietitian, and then psychology, being counselors and helping patients with brain health. Um, so really working in healthcare, the skills that are really important, no matter what job you're doing, whether it be a nurse or a physical therapist or working in the pharmacy, you have to be able to be good at working with people. So if you like being around people, communicating with people, interacting with people, and helping people um, achieve goals and to feel better, we need people that care about people to be in healthcare. That's kind of one of the most important things. We need people that are good listeners. A lot of times patients will tell us things that they might not be comfortable telling their family. So we kind of become the people that they can confide in and trust. We need people that are good team players. So people that are willing to help each other, that can be flexible and try to look at how they can help someone else to be successful. Um, People that complete their work in a timely manner, that they're reliable and things like that.
Absolutely. Thank you so much, Matt, for touching on like the employability skills. I know I'm always touching with students on those hard skills you're going to learn. You're going to get taught by your business, but before you even get that job, you have to understand employability skills and those soft skills of how you can work together, the critical thinking, the good listening. Oh, fabulous hitting on that.
Yep, yep. Um, and I did have a short video, but we don't need to play it. But just a little bit about Stonehill. So I kind of mentioned earlier in the presentation just that our environment at Stonehill is to help older adults, um, that need different levels of care. So we serve people that have memory care needs. We have people that live with us that Stonehill becomes their home when they're no longer able to take care of themselves at home. We have people that come in after they've been in the hospital and they need rehab with therapy. Um, so we have a lot of different services on our community, and we're actually looking to get into home care, um, so that we can continue to transition care into that setting as well.
Well, kudos to you. The healthcare workers are the heroes of our society. We just have a couple quick questions, and I know we're close on time, but these are kind of a little open-ended. But what do you like most about your career?
I think for me, I like helping people. So, thinking back to when I was looking at what I wanted to do with my career and how I ended up where I'm at, I think you're never quite sure exactly how you'll get to where you want to go, but somehow it always works out. And I always knew that I wanted to help people, and I didn't know exactly what that looked like or how that would fit into my life. But my own story is, kind of like many, where I started out thinking I wanted to be a physician or a physician assistant, and now I'm a nurse. So people, it's very common for people to not exactly know what they want to do, especially young people and the students that might be listening to this presentation. But I think you'll find your way, and I think if you want to be in healthcare somehow, you'll figure out where you fit best. And for me, I just enjoy helping people.
Fabulous. Well, and as you touched hard on, healthcare is open-ended. There are so many opportunities and different umbrellas that students can go into. If they don't like one, they can try a different one. So then last question, what do you dislike about the career?
Healthcare is delivered 24/7, so 24 hours a day, 7 days a week. So I think people going into healthcare it's important that they understand that the needs of patients happen around the clock all year long. And so, every setting is different, and every area of healthcare is different as far as hours that people work and things like that. But I think being in healthcare, you're needed all and potentially at different times of the day. And so I think that work-life balance can sometimes be a challenge for people in healthcare. But I definitely think that, people going into healthcare, if you know that kind of model and that the needs of patients are going to happen around the clock, you'll figure out a way to incorporate that into your life and be able to achieve work-life balance. But it's not like going to a bank. Banks, they're open maybe 8:30 in the morning until 5 o'clock at night, Monday through Friday. um, in healthcare, there's needs on weekends and holidays and things like that. So um, it all has to balance. And but that is one thing to keep in mind when you're looking at healthcare.
Great touch point on that. Thank you, Matt. Well, that would kind of conclude all of our questions in your PowerPoint. As Stephanie said, this has been recorded. It will be shared out with our students and schools. So we appreciate your time and everything you shared and everything you guys do at Stonehill Communities.
I appreciate being here. Thanks for having me.